Okay, so we're going to finish off the axial skeleton here with the vertebral column. And obviously the vertebral column is going to run from the skull all the way down to the pelvis. We oftentimes call it the spine or the spinal column. And then the main functions of the vertebral column are going to be obviously one, to protect the spinal cord. That's a big one, right? But two, also it's going to transfer the weight of the trunk and the upper body to the lower limbs, since we walk on two legs. And then we're bipedal, right? And then also it's going to provide attachment points for not only the ribs, but also many muscles as well. And we'll talk about some of those muscles coming up in the next chapter. So when we look at the vertebral column, we're going to break it up into these 5 different regions: the cervical vertebra, here the thoracic vertebra, the lumbar vertebra, and then here the sacrum, which are these 5 fused vertebra, and then the coccyx, which is going to be these 3 to 5 fused vertebra. They give you the average, which is 4. So the easy way to remember this and how many vertebrae are in each of these sections is to think of it as breakfast, lunch, dinner. Okay, you eat breakfast at 7, lunch at noon, dinner around 5 if you have kids. So that's kind of the easy way to remember that there are 7 cervical vertebrae, 12 thoracic vertebrae, and then 5 lumbar vertebrae. And then the other 2 are just 5 fused for the sacrum, and then anywhere from 3 to 5 are fused for the coccyx. Again, your book is, many of the textbooks will give you the average, which is 4. So when we look at the vertebral column, right, in between the vertebra, we have these intervertebral discs that act as these kind of like shock absorbers, right? And so when we look at these intervertebral discs, remember that they consist mostly of fibrocartilage. So they have this kind of fibrocartilaginous ring. And then the center of them is this kind of squishy pulp center that we call the nucleus pulposus. And again, this tough fibrocartilage, again, helps that intervertebral disc to maintain its shape, but this nice kind of soft squishy center allows it some shock absorption. Okay, so again, you can see this is compressed in like a weight-bearing situation here. And so that's, again, the purpose, right, of our intervertebral discs. This was, you don't have to know by any means these ligaments. I just wanted to show you the ligaments that do help to hold the vertebral column together. So there's quite a few. So I just wanted you to see that it was reinforced with quite a few ligaments here. And then we'll talk about things like the intervertebral foramens here and what comes through there. You can see here, so this is what's called a herniated disc. And so what happens is you end up getting protrusion of this nucleus pulposus disc, or nucleus pulposus squishy center, okay, of the disc, and it actually pushes out, and oftentimes you have a weak point in the fibrocartilage here, and can actually push on your spinal nerves that we'll talk about are coming out of that intervertebral foramen here. And so obviously you can see this would be both painful and also can be debilitating because you're compressing these spinal nerves, and some of those spinal nerves could be involved with, your ability to walk and things like that. So that's what happens in a herniated disc. I have another image of this kind of towards the end when we talk about the clinical aspects of the vertebral column. But here you can actually see here's a herniated nucleus pulposus here, or what we call a herniated disc. And so you can see the intact discs here, and then here you can see the protrusion of that nucleus pulposus into the spinal canal, and it would compress again those spinal nerves, and you can see how it could be quite painful. And sometimes again they can go in and repair this, and then sometimes if it's just too bad, the herniated disc is too bad, they can actually do a spinal fusion. So they'd remove that fibrocartilaginous disc and then put something that would create a space in here and then fuse those bones together. So when we look at our spinal curves, we actually don't start life with all of the curvatures that we have now. And you guys probably know that if you've ever had an infant. So we start out life with these kind of two primary curves. So you can see we have a curve here and a curve here. So we call this the thoracic curve here, and this is the sacral curve here. And those are primary curves because they're formed during fetal development, and then we keep them, right, as an adult. So any of the curves that go this way are our primary curves. So again, the thoracic and the sacral curve we keep as an adult. Now, our secondary curves we develop later in life, hence the name secondary. So as we develop the ability around, 4 months or so to be able to hold our head up, then you develop this first cervical curve here. And then as you develop the ability to walk around 1 year old, sit and walk upright, then you develop this lumbar curve here. So again, the cervical and the lumbar curves, because you develop them later in life, are going to be your secondary curves. So, and this is pretty easy to, again, if you've had kids, you kind of probably can intuitively figure this out. And then this is just showing you the breakdown of the vertebral column. And again, and it of course gives you the average for the coccyx. Again, it's going to be 3 to 5, just depending on the individual. And we're going to go through each of these sections and talk about the vertebra and the differences between the cervical vertebra, the thoracic vertebra, and the lumbar vertebra, because they're quite different. And then we'll get into the sacrum and the coccyx. Really quick, as we talked about some of those curves, I want to talk about kind of the imbalance of some of these curves, or the abnormalities of these curves. So we can have something called scoliosis, and scoliosis is going to be kind of a lateral, basically like a lateral rotation of the spine. So again, it creates this kind of, abnormality where the spinal cord actually moves out laterally or sideways. So it kind of creates this like S-shaped spine, basically vertebral column here. So that's scoliosis. Again, obviously quite painful. In this case, I'm sorry, I'm just going to turn on my pen here, so it would be nice to have my pen. So in this case here, in kyphosis, maybe I'll turn on my pen. Sorry about that. I'm not sure why I didn't want to turn on. So in this case right here, this is an individual who has kyphosis. It creates this kind of hunchback here. And so kyphosis is this kind of abnormal dorsal thoracic curve. So it's like a really pronounced here thoracic curve, and that can lead to obviously pain and all kinds of issues here as well. It's more common in people with like osteoporosis or rickets, things like that, but obviously it happens to individuals as they develop osteoporosis as they age. And then we have this case here, which is lordosis, and ironically, they show you a picture of pregnant women. It's very common in women that are pregnant to accommodate, again, for the extra weight. And so lordosis is oftentimes what we call swayback, and it's an accentuated lumbar curvature. So again, here we have the accentuated thoracic curvature. Now we have an accentuated lumbar curvature. You can see that. And again, this can sometimes result from different diseases, or it's often seen in overweight men with kind of those pot bellies, and then also very common, obviously, in pregnant women as well. So let's go ahead and get into the general structure of the vertebra, and then we'll talk about the different vertebra and what makes up the differences between these vertebrae when we look at them at the level of each vertebra. So I'm going to go ahead, I'm going to show you these structures, the body, and then the vertebral arch is going to be consisted of the pedicles and the lamina. I'll show you these. And then we'll have the vertebral foramen. So all of these, the body and the vertebral arch, will encircle the vertebral foramen. And that vertebral foramen, I'll show you in just a minute, is where the spinal spinal cord is going to move through. So again, foramen, remember, being an opening. And then all of the vertebral foramina together of all of the vertebrae are going to form, obviously, the vertebral canal, or the spinal canal. And then the intervertebral foramina, I'll talk about in just a minute, and then I'll show you on either side. You'll see this is where the spinal nerves are going to enter and exit the spinal column. So if we want to look at this up close here, I'm going to show you all of the parts just for the purposes of lab. So again, we talked about the fact that you're going to have the vertebral arch, and the vertebral arch is going to consist of this part here's the lamina here, and then here is the pedicle here. So this part here is the pedicle. So here's lamina coming in here, and then here's the pedicle here. Okay, and so that lamina here and the pedicle are going to form this vertebral arch. So again, lamina here and then pedicle right here. They fuse together here, and that forms this vertebral arch. And then together here with the body, this is the body. Sorry, I'm really doing a horrible job. Looks like my kindergarten coloring again. But here's the body that's kind of the bulk of the vertebra, right? That's bearing a lot of the weight. And so together, the body along with the pedicle and the lamina here are going to create this vertebral foramen, okay? And that vertebral foramen is where the spinal cord is going to run. Okay, so this is how, again, the vertebra protects the spinal cord. A couple other features now that you've got kind of the base of each of the vertebra, you're going to have these processes that stick out. So these are going to be the transverse processes, okay, on the side. And then you're going to have the spinous process in the back. This is the most posterior process. And you can, these are the ones that you can palpate. You can actually feel your your spinous process. If you run your fingers down your back, you'll feel the tips of those spinous processes, okay? And obviously these are going to be processes that are really important for muscle attachment, as well as for your thoracic vertebra. The ribs will actually attach here. So again, important processes to know. And then each rib obviously is going to have an articular facet on the top. So it's going to articulate with the other rib, right? Right above it. And that's going to be your superior articular facet. And then on the underside, it's going to have an inferior articular facet. And that inferior articular facet is going to articulate with the vertebra below it. I had ribs on the brain there. So again, those superior articular facets and the inferior articular facet are going to allow it to articulate with the vertebra above it and the vertebra below it. So when we talk about the vertebra, again, we talked about all of these, the spinous process, the transverse process. We already talked about the superior articular process is just the process where that faucet's going to sit, and same thing here, that inferior articular process. They're just talking about this kind of process that sticks up with the faucet on top, okay? And there's an inferior one as well. So here you can see the inferior one. So here's that inferior articular process with the inferior articular facet. And this, again, is going to articulate with the superior articular facet of the vertebra just below it, okay? So again, just a couple of the same features that we talked about, the body, again, being that weight-bearing portion of it. The vertebral arch, again, consists of the pedicles and the lamina. So here's the lamina here. Here's the pedicles here. And then, again, the vertebral foramen. And then those 7 processes, transverse processes, spinous process towards the back, and then those articular processes. So again, the superior articular processes and then the inferior articular processes. And then also really important is going to be this thing right here, called the vertebral notch. So this is going to be the inferior vertebral notch, and then you're going to have a superior vertebral notch here. And so what's going to happen is when the vertebra above it sits on top here, the inferior vertebral notch is going to match up with the superior vertebral notch. And this is going to form what's called your intervertebral foramen. So think about intervertebral. Inter means between the vertebra. So this is going to be your foramen that are formed again in between the vertebra from, again, that inferior vertebral notch of the vertebra above, and then the superior vertebral notch of that vertebra below. I don't know why I have ribs on the brain right now. So, and again, you can see these intervertebral foramen are going to be what's going to allow your spinal nerves to enter and exit the spinal column. So again, here, these intervertebral foramen that are formed again from those vertebral notches, the inferior and then the superior vertebral notch of the vertebra below are going to be what forms that. Okay, so again, really important because obviously we need to be able to have our spinal nerves enter and exit the spinal canal. So this is kind of cool. This is actually an animation. Let's see if I can get it to play here. If I turn off my pen, I don't know, it should just play. I'm not sure why the animation isn't playing here. Should just play if I click it. Well, bummer. I'm not sure why the animation, it should play for you if you open this up. But it's really cool because you can actually rotate. It'll rotate the spine so that you can see the different, foramen basically. So here you can see again, this is that vertebral foramen where the spinal cord would run. And then here it's nice if you rotate this one, you can see the intervertebral foramen where those spinal nerves enter and exit. So I'm going to try one more time and see if I can turn off, maybe if I turn off my pen, turn that off. Aha! So here we go. So it's cool because there you can see those intervertebral foramen where the spinal nerves are entering and exiting. And then here again, you can do the same thing with this one. And there you can see those intervertebral foramen coming in and out of the spinal cord. And then there's that vertebral foramen where the spinal cord runs. So again, pretty cool. I like those animations just because it helps you kind of, I feel like, visualize those different foramen. Okay, so let's go ahead and move on to the cervical vertebra. So we're going to talk about the vertebra. We're going to talk about each vertebra and what kind of makes up that vertebra and how it's different from the next region. So first we're going to talk about the cervical region. And the first and second cervical vertebra are going to be special ones. So they're going to kind of get their own slide here, and that's going to be the atlas and the axis. So C1 will be the atlas and C2 will be the axis. So I think the easy way to remember this is T comes before X. So if you can't remember which is which, or you can think the atlas is going to rotate, you'll see around the axis. So anyway, I'll show you this in just a minute. And then the third to the sixth vertebra, C, so basically C3 to C6 are going to be your very typical cervical vertebra. And then the seventh one is kind of the special one called vertebra prominens, but we're not going to talk too much about that one. So let's talk about, for the most part, when you look at your cervical vertebra, C3 through C7, you're going to see that they have a smaller body, obviously, because, again, you're just supporting the head. So you're not supporting like a lumbar vertebra, the entire trunk. And then you're going to see these transverse processes. This is really your key giveaway that you have a cervical vertebra. If you have a transverse process and it has a foramen in it called the transverse foramen, it is for sure a cervical vertebra. So there's your for sure for lab. And so that's because here we need these transverse processes to have these foramen that will actually allow, blood flow basically. So it'll allow blood vessels up to the head. So kind of important, and nerves as well. So kind of an important foramen. So again, we've got especially blood vessels like the vertebral artery running through those transverse foramen. And then the spinous process for C2 to C6 is oftentimes what we call bifid. So instead of having just one long spinous process like you're going to see in like your thoracic vertebra here, I don't know why it doesn't like that pen color. You just have one long one coming out. Instead, you're going to have this kind of short bifid one. It bifurcates, okay, into these kind of two parts. And then let's talk about the first and the second vertebra. So the first one, C1, is the atlas, and you have this anterior arch of the atlas that is going to articulate with what's called the dens. The dens or odontoid process both mean tooth-like. So both terms mean tooth-like, and that's because somebody thought it looked like a tooth sticking up. And so your anterior arch of the atlas is going to rotate around the dens here. And I actually ended up creating, I couldn't find a good animation, so I actually created a video for you to show you this because I think it's hard to visualize without it. So the atlas here, again, is going to have those superior facets here, and these superior facets are going to articulate with the occipital condyles, I'll show you this in the video in just a minute, of the skull. And so this is going to form what we call the atlanto-occipital joint, okay? Because, again, it's a joint between the atlas and the, again, occipital condyles of the skull. Okay, and so this is going to allow you to do this yes movement that you're going to see in the demonstration in just a minute. And then the axis, again, has this dens process. And again, it's going to articulate here with this anterior arch, with that articular surface on the inside of that anterior arch here. And we call this joint the atlanto-axial joint because it's between the atlas and the axis, and it's going to allow you to do that no movement. So I'm going to go ahead and show you this in my quick video that I created, a video within a video here, so that you could see this. So I'm first just going to show you the atlanto. I'm sorry, guys. Let me go ahead. Get that. Sorry about that. I had to unplug my headphones and it blipped out for a minute here. So I'm first just going to show you the. Well, maybe it's not going to play for you. Let's try one more time. So I'm first just going to show you the atlanto-occipital joint. So the atlanto-occipital joint is just like it sounds. It's going to be between the atlas. So here I have the atlas for you, and this is the actual anterior arch. Here is the superior articular facet, and they are going to articulate with the occipital condyles here. So you can see these large occipital condyles of the skull. And so if you look here, those are going to sit here just like that. And what's going to happen is this is going to allow you to do this up and down yes motion of your skull. So it'll allow you to do this motion. Okay? So that's gonna be your yes joint. Okay? So that's the atlanto-occipital joint. Now the atlanto-axial joint is going to be between the atlas and the axis, so just like it sounds. So again, this will be here between and you're going to have the inferior articular facets now of the atlas are going to be sitting on the superior articular facets of the axis. Okay, and then you're going to be able to see here, I'm going to try to turn it this way, that here that anterior arch can rotate around the dens of the axis. Okay, so it'll actually allow you to do that no motion.
to shake your head no. So when you think of those two joints, you can thank the atlanto-occipital joint every time your child says yes to you, and you can curse the atlanto-axial joint every time they say no.
So hopefully that will help you remember those two joints a little bit. I'm gonna plug back in here. I couldn't find a on that, so I just kind of created my own quick video there. So hopefully that will help you out. And so those are the cervical vertebrae. So now we're going to move on to the thoracic vertebra. And so if you look at your thoracic vertebra, again, the body, I'm going to grab my pen back here. Still doesn't like that color. So the body's going to be a little bit larger here. Again, obviously it's having to bear a little bit more weight as you added the limbs now. And you're going to see that they have longer transverse processes here. And that's going to be because you're going to, these transverse processes are going to articulate with the ribs. And then you're going to see you also are going to have a longer spinous process as well, as that longer spinous process is going to have these larger muscles that are going to attach to it. So it's a little bit larger. And then you're going to see that you have the superior articular facet, just like you did before, right, to articulate with the vertebra above, and then you'll have the inferior articular facets on the bottom to articulate with the vertebra below. And then, then you're going to have, again, these odd little articular surfaces here called the demifaucets. And the demifaucets are going to be on the body. And this is going to be where the rib, and especially here, this is going to be where the head of the rib is going to articulate with the vertebral column. So what's going to happen is your rib, I'm going to kind of draw it in here. The head of the rib is going to come up like this. And then there's going to be this thing called the rib tubercle that's going to articulate here with this articular facet on the transverse process. And then the rib's going to kind of come down around, oops, sorry, I wanted to make it a little more rounded out here, and come around this way. So again, your rib's going to kind of come up and then around this way. Well, obviously it's going to be much wider as it goes. Doesn't leave much room for the organs in here, does it? But you kind of get the picture. So again, the head of the rib is going to actually articulate with that demifaucet on the body. And then here, the rib tubercle here is going to articulate with this articular surface of the transverse process, or articular facet of the transverse process. So those are the kind of main features of the thoracic vertebra that you're going to see. And again, that big thing is that you're going to have these facets on the transverse process that are going to be different because you won't see those on the other vertebra. And that's because, again, the rib tubercles are going to be articulating here. Same with these demifaucets. So again, big difference there. Let's go ahead and talk about now the lumbar vertebra. The lumbar vertebra are obviously going to be the largest and the strongest vertebra, again, because they have to support the entire body. They really help to provide a help stabilize our upper body onto our legs, providing a stable base for the trunk. And again, this really helps to make sure that your bottom half attaches in a stable way to the upper half of your body. So again, they're going to have this really kind of bulky body. You have these kind of short, thick spinous processes. Again, they're going to be really thick for larger muscle attachments. And then the transverse processes here will be kind of short and thick as well. You'll see this in another view in just a minute. And then you see all the same features that you normally would. And again, these short kind of, they're kind of these short, bulkier processes are going to allow for some of these larger muscle attachments for the back musculature. So I just wanted to show you, this is, I think, a great way to remember the vertebra, especially if you just get like a single vertebra on like a lab practical and are asked, what is it? I always tell people it's easy to remember the cervical vertebra because the cervical vertebra, remember, are going to have those transverse foramen and the transverse processes. So that's the first thing you're going to ask yourself. Does it have a foramen in the transverse process? If there's no transverse foramen, okay, then throw out cervical. So then now you're left with thoracic and lumbar. So the thoracic vertebra, if you turn it around and look at the posterior end of it, many students have said that they feel like it looks like a giraffe. And obviously so much so that there are pictures on the internet. And again, it's partially because they have that really long spinous process, same with the long transverse processes. Now the lumbar vertebra, again, because they're more bulky, those processes are more bulky, it looks more like a moose. So again, kind of says everything about what your lumbar vertebra does, right? So those are some easy ways to help you out with the purposes of the lab. So this is a nice side-by-side. I like this again, comparing the cervical vertebra. Again, remember this is just C3 through C7 because C1 and 2 are the atlas and the axis. They're the special ones. But again, you can see those transverse foramen, okay? And then that vertebral foramen is fairly large there. And then here you can see the thoracic vertebra, again, being different in that they have these kind of really long transverse processes. They have the facets, what we call the transverse costal facet, because you're going to see it's actually going to articulate with a costal cartilage. So we'll talk about that. Or I'm sorry, no, it's going to articulate here with that rib tubercle, I'm sorry. And then I'll show you where the costal cartilage is going to come. But they call it costal because, again, it's rib. So that the rib tubercle is going to come up and articulate here. And then here, again, is going to be the head of the rib. So, again, head of the rib comes on up, rib tubercle, okay, and then on out. So it's going to look, oops, not like that. Sorry, don't ignore that part here. And then here. So just giving you kind of an idea of how that rib's articulating again. So that'll help you identify the thoracic vertebra. And then here, that lumbar vertebra, again, is got a really bulky body. That'll help you to remember that. And those transverse processes and spinous processes aren't quite as long. They're more kind of bulky. And so you can see that in the different views here. And then, so let's go ahead and we'll go on to the sacrum. So if you look here, here's your sacrum. And again, remember, it's going to be the union of these 5 vertebrae, S1 through S5. And these vertebrae actually are fused by age 30. So by age 30, again, there's no cartilage in between these vertebrae left. And that's one of the ways, again, that you can age someone's skeleton. Again, if these are all fused, then they're over the age of 30. And then here, this, what we call the sacral crest here, is actually the fusion of the spinous processes. What were the spinous processes there? So that's, and then the sacral ala, so pronounced ala, sacral ala. I don't know if I have that in here. Oh, there it is. Sacral ala is going to be just the fused transverse processes. So this used to be a transverse process. And again, this is fused now with this and this. So we call it the sacral ala. And let's see, the sacral canal here. So this is where the sacral canal, where the spinal cord would run. And so you can see this here is what we call the sacral hiatus. And that kind of is where the spinal nerves will exit at that sacral hiatus. And then let's see. Then when the last bit here is the coccyx or the tailbone. And this, they put again 4, but there could be anywhere from 3 to 5. They just picked the average. And again, these are going to fuse around the same age by 30. These bones will be fused, forming, again, what we call the tailbone. And obviously you can see this bone is oftentimes easily broken. And what we call the caudal or epidural anesthesia is oftentimes given around here during delivery, delivery of a baby. And so that's why that's kind of an important landmark. Okay, let's go ahead and get into the ribs. So when we talk about, sorry, I'm going to use this diagram. When we talk about the ribs, obviously you can see here, this is going to provide the protection for your thoracic region and the organs within, especially the heart and the lungs. And so to form this kind of bony cage, you can see here, this is going to be the sternum. So which will be broken up into, so the sternum here is this whole section here will be broken up into the manubrium. So it'll be this bone right here. And then the body of the sternum. And then here's the xiphoid process. We'll talk about that as a landmark here. And then when we look at our ribs here, our ribs are going to be broken up into what we call our true ribs. So our true ribs, or I like the term vertebrosternal. So you'll see these terms all on this slide here. But I like the term vertebrosternal because it tells you that these ribs here are going to attach directly to the sternum by their own costal cartilage, okay? So if you look here, each of these has their own costal cartilage and it's attaching directly to the sternum. So again, those are ribs 1 through 7 and we call them our true ribs, again, or vertebrosternal ribs, okay? Now ribs 8 through 10 are what we call our false ribs, and that's because these are going to attach indirectly to the sternum by joining their costal cartilage here to the costal cartilage of rib 7, okay, to the costal cartilage here of rib 7. So you can see that's where we call these the false ribs, okay, or I like, again, the term vertebrochondral because it tells you, again, that they're attaching, again, to the cartilage of another rib. Okay, so vertebrochondral. And then 11 and 12 here. So if you look down here, you can kind of see 11 and 12 back here. Here's 11 and then here's 12 back here. These are the floating ribs, and you can see they're not attached to the sternum in any way up front, hence the name floating. And again, so here you can see this, what actually attaches the ribs to the sternum is actually this cartilage here that we call costal cartilage, which again, if you remember, consists of hyaline cartilage. When we talked about hyaline cartilage, that was one of the examples that we gave. Okay. And then obviously, again, in the ribs in the back attach to those thoracic vertebrae, and they attach to those thoracic vertebrae, again, remember the head of the rib attaches to the demifaucet, and then that rib tubercle attaches to the transverse faucet. So again, you can see this. I like this to just show you that articular surface. So again, the head of the rib is attaching to that demifaucet on the body. And then you can see here that rib tubercle is attaching to that transverse costal faucet of the vertebra. So that'll kind of hopefully help you out with lab. Again, you don't need to know the ligaments. I just like to show you that there are ligaments that stabilize that and help to hold the rib in place with a thoracic vertebra. And then here you could just see the rib and you can see the head and then that rib tubercle as well. So I just wanted to show you that. Again, this is a herniated disc. So I told you I'd show you a slide of this at the very end. So again, you can see this is a good depiction of what happens with that nucleus pulposus. You can see, again, that like squishy center. And if for some reason, again, there ends up being like a weakness in the fibrocartilage and for some reason that nucleus pulposus pushes out of that disc, and this most commonly, again, happens oftentimes in the lumbar region, then it can compress these spinal nerves that are entering and exiting the intervertebral foramen, as well as it can compress the actual spinal cord, again, causing quite a bit of pain. So there's a couple things they can do. They can do what's called surgical removal of the disc after they do what's called laminectomy, where they have to open up the lamina here to get in and remove that disc. And then, again, they can fuse the vertebra together, and that's, again, if it's a really bad herniated disc. Another clinical application is this disorder called spina bifida, and so this is a congenital defect. It happens if during development you're not able, the mother isn't able to take in enough folic acid. And what happens then is the vertebral column is not able to form properly because of that lack of folic acid. And so what ends up happening is the vertebral lamina actually fail to unite. So you can see here, those vertebral lamina fail to unite, and then that allows this nervous tissue or spinal tissue to protrude outside of the vertebral column and sometimes even outside of the body. And that leaves the nervous tissue highly unprotected and can cause, obviously, severe issues for that child, including paralysis and death. So most of the time now, if they detect spinal bifida, they actually will go in and surgically repair that in utero, which is pretty amazing now. So that concludes the axial skeleton. As always, if you have any questions, let me know. And then I put the end until the appendicular skeleton. But the appendicular skeleton is always fun. The limbs are pretty easy because most people know a little bit about the limbs. All right, I'll see you next time.